This is Dr. Mark Hyman at the Center for Functional Medicine in the Cleveland Clinic, and I'm with Dr. Sarah Hallberg, who is the medical director of Virta Health and also the executive director of the Nutrition Coalition to Advance Science and Policy, which is a great idea. What a concept. And we're privileged enough to hear her grand rounds on the ketogenic diet and type 2 diabetes. And it was really an overwhelming tour de force describing a radically new concept around food. And there was an endocrinologist here from Cleveland Clinic who shared with me that this is something she's interested in, and she's astounded that her endocrinology department, her community doesn't talk about food as medicine and is not focused on these issues. So thank you for sharing your wisdom and your experience.
Thanks for having me.
I have a bunch of questions, which I'm sure many people have as well. Couple of things. One, the ketogenic diet, is it something for everyone, or is it a therapeutic diet for people with cardiometabolic diseases and neurologic diseases?
So that's a really great question, and the jury is still out on that. So, my focus is in utilizing the ketogenic diet for metabolic diseases, most specifically type 2 diabetes, but of course prediabetes and insulin resistance. So who else is it going to be applicable to? Well, we already know that it's utilized in some neurologic diseases with great success, like epilepsy. Where is it going to expand from there? We're not sure, right? This is a real emerging science. What else could benefit? What other conditions, chronic health conditions, could benefit from a ketogenic diet? Because when we look at problems that plague humans, right, what we see, unfortunately, is that most of these conditions are actually nutrition-related diseases. So we think that a ketogenic diet may play in for a whole host of things that we're not currently utilizing it for. One of the ones that really piques my interest, for example, is autoimmune diseases. What kind of role can the decrease in inflammation from a ketogenic diet play in that? So the question right now is, there are certain things that we're sure about when it comes to a ketogenic diet being appropriate. Metabolic disease, epilepsy, absolutely. Where else are we going to be utilizing this? I think in the next few years, we're going to have a lot more answers on this, but I do think we're going to see more widespread application in using the ketogenic diet to treat these overwhelming nutrition-related diseases.
So that speaks to the fact that this is a medical intervention.
This is absolutely.
And the question then is, keto is all the rage. All the top diet books are keto. Everybody's doing keto. If you're healthy and fit and you're metabolically resilient, is it something that you need to do, or can you actually get the same benefits in longevity and health by just eating a lower starch diet and sugar diet, but not necessarily a keto diet?
We don't know. And so, one of the things when patients come to me, if they aren't metabolically unhealthy and they're doing a ketogenic diet, one of the first things I'll ask them is why. And so I'll tell you the reasons why people are doing it, even who are metabolically healthy. Number one, that seems to be having great success is migraines. So people do it as a way to combat migraines and get off of a lot of migraine-related medications. Again, an area where we need more research, because a lot of it is anecdotal at this point, but people who do it for that purpose wind up being really happy about it. Other people do it because they're tired and they feel that they have cognitive fog, so to speak. And so a lot of people start and maintain a ketogenic diet because they feel like it improves their alertness and their cognition. That's another really popular reason for people to do it. Other people are doing it because of family history of some of these metabolic diseases, even though they themselves have not developed any yet. So sort of a preventative approach. And I think we're going to probably find in the future that use of a ketogenic diet for prevention is probably going to be indicated, but we're not there yet. So if these people are feeling really good, if their labs continue to look good, I don't see any reason why we have to encourage them to stop a ketogenic diet. But it's always something to discuss. What do we know about a ketogenic diet? Where is there evidence, and where is there maybe a lot of anecdotes, but not solid evidence?
Yeah, it sort of brings up a bigger question of health, longevity, aging, wellness. And there seems to be emerging data on fasting mimicking diets, intermittent fasting or time-restricted eating, and calorie-restricted diets and ketogenic diets all creating the same metabolic effect, which is essentially improving insulin resistance, decreased inflammation, upregulation of antioxidant systems, increasing stem cell production, increasing lean body mass, decreasing osteoporosis, increasing cognitive function. And these are across the board. So why would you pick one or the other? What about just intermittent fasting? Is that actually the same thing, or does calorie restriction, or does fasting mimicking diets, which people are using to actually reverse diabetes? How do you sort of sort through that mess?
Well, so I think one of the central questions that we would raise in looking at different methods of improving health is beta hydroxybutyrate, right? A lot of these, especially the time-restricted feeding and intermittent fasting, one of their key components may be that they do increase levels of beta hydroxybutyrate. And so we, again, jury is still out on if that is absolutely critical, but I think more and more studies are pointing to the fact that beta hydroxybutyrate is much more than just a ketone body. It actually acts as a hormone. Okay, we know that it influences gene expression. I mean, there's a really well done study on this showing its impact on histone deacetylase complexes. It decreases inflammation, which are central to so many of these diseases. And maybe how you get about getting the elevated levels of beta hydroxybutyrate can be patient choice moderated, but maybe getting to that some level of beta hydroxybutyrate in your circulation may be critical. And I just want to point out one other thing as we look at these different ways to possibly get there and the different dietary interventions. I really do feel that there's more than one way to skin a cat, and that the patient choice aspect to what they're going to do, looking at disease reversal, is really critical. And so we can't forget that. But I want to also point out intermittent fasting. And I say this all the time to patients who come in telling me that they're intermittent fasting. And that is, what is their definition of intermittent fasting, right? Because when we get into intermittent fasting, which means fasting for these very prolonged periods of time, that actually can have detrimental effects on the lean body mass. When we get into intermittent fasting, which is really more time-restricted feeding,
16-8.
Yeah, those kind of splits. Yeah. There is evidence to show that they can be beneficial and not impact negatively the lean body mass, and may very well actually help preserve the lean body mass too.
Okay, well, let's dig into a little bit different aspect, which is cardiovascular risk and the microbiome. So start with cardiovascular risk. There's still, even though we've sort of moved away from the low-fat paradigm, and even though the dietary guidelines have eliminated any total fat, there's still a fear of saturated fat, and there's still a fear of adverse effects on lipids and cardiovascular disease with high-fat diets and ketogenic diets. And I think, we don't really have long-term data on what happens when people stay on ketogenic diets for 20 or 30 years in their cardiovascular risk. But we do know from your data that I'd love you to share about the cardiovascular issues. And I think there's a lot of heterogeneity in the population, myself included. When I do a high-fat keto diet with high saturated fat, I have adverse effects on my lipids. And you said that's sort of an outlier called a lean body mass hyper responder. So can you talk about the arguments that this is bad because it contains a lot of saturated fat, and what should we do about that?
Yeah, so the real concern about saturated fat, right, is exactly what you just said, is elevation in lipids. So what we see in our study, but also in many other studies, when you take some patient population that is metabolically unhealthy, like there's been a number of studies done on patients with type 2 diabetes, and we put them on a ketogenic diet with presumed elevation of saturated fat levels. Not all of them have looked exactly how much saturated fat these patients are getting, but they're counseled on foods that are high in saturated fat. When we take those metabolically ill patient populations, what we see on average is that the cholesterol changes are all positive. We're not seeing these big rises in their LDLP or ApoB. We're seeing improvement in all markers of atherogenic dyslipidemia. However,
so if you're sick, you get better. If you're healthy, you get worse.
Well, if you're healthy, there's a split, right? We have some people who are well, who go on a ketogenic diet, well meaning metabolically well, who go on a ketogenic diet whose cholesterol doesn't change, or in some cases gets better. Okay, I would say that's the majority of patients who are metabolically healthy. That's what occurs. But we have a subset of patients that we can't ignore. Okay, that when they go on a ketogenic diet, they have this exaggerated LDL response. And so that can mean not only an elevation in LDL-C, but also an elevation of LDL-P and ApoB. So we see things.
And small particles?
And small particles in some cases.
Seems
even
sort of
that.
counterintuitive.
Right, it does. And so as far as right now, here and today is concerned, okay, because we don't have a good answer as to why that is occurring, my approach is that's serious, that's an increase in cardiovascular risk, and I treat it as such, okay? What we really need is a study on this very specific patient population, okay, because there are a lot of theories as to why this is rising, and some of them would represent increased cardiovascular risk, but some of them wouldn't, okay? And so right now, again, what is really important for everyone to understand, including providers, that is at this point in time, because we do not have evidence that this is not an increased cardiovascular risk, we must treat it as such. We must treat it appropriately, okay? And we must inquire with a person, why are they doing it? Okay, so let me give you a quick example here of a patient recently who came into my practice who had high cholesterol to begin with, but had a really exaggerated response to a ketogenic diet, and her LDL particle number went through the roof. It was actually over 3,000. And I said to her, she was very lean.
And ideally, it should be under 1,000.
Right, correct. So it wasn't there to begin with, let me point out, saying, but the point is it increased from uncontrolled to very uncontrolled, okay? She was lean, and my question to her was, why are you doing this? She said, I'm doing this because I had an overnight improvement in my migraine headaches. I'm off of really bad stuff. I'm off of the Botox injections I was getting. I'm off of the 3 oral medications I was taking for both prevention and abortion of a migraine. And I feel so much better. It's improved my quality of life. Okay, increased LDL. What are we doing? We don't want to swap one problem for another. So my instruction for a patient like that is a statin medication. And what we see in those cases of people who are doing it for a very specific reason, having a lot of success with it, a low dose of statin will dramatically drop that LDL.
What about switching out the fat and removing saturated fat and increasing MUFAs and PUFAs?
So in some cases that can help. We don't generally encourage increase in PUFAs because I think the core to a well-formulated ketogenic diet is a whole food-based diet. And so we discourage any industrial made vegetable refined oils. And so certainly increase PUFAs in the sense that, we can push fish and things that contain nuts and seeds that contain natural omega 6s and omega 3s, but we definitely discourage any of the soybean or vegetable oils, so to speak, for our patients. But definitely an increase in MUFAs works some of the time, and that is absolutely an option. And then you just have to follow the patient to see what kind of their response is. We want to make sure, again, and I just continue to come back to this because I think it's such an important point, is that until we have definitive answers about this very specific patient population that has these exaggerated LDL responses, we have to treat them as increased risk. And whether it's attempting first to change the type of fat they're consuming and following, or whether in a discussion with the patient, they don't feel like they could make that change, which is a lot of the time the case is. Patients say, look, if you have to take away my heavy cream or my butter, I don't think it's sustainable for me. And in that cases, we may, low-dose statin may be more appropriate for them, okay? It's important to have the discussion with the patients and then follow up to make sure that you're successful. Because again, until we know, we don't want to trade one problem for another.
That's great. Okay, next topic, microbiome. So looking at the data on microbiome is fascinating because it seems that in many studies, high-fat diets, particularly ones that are high PUFA diets, have all adverse effects on the microbiome, increasing inflammation, increasing insulin resistance. And if you're reducing carbohydrates, you're reducing plant foods, which are the source of most of our fiber, including whole grains, beans, as well as even vegetables, which are not really unlimited necessarily on a ketogenic diet. And how do you sort of make sense of that data and what to do about it? Because if the microbiome is switched into an adverse inflammatory state, could it counteract the ketogenic diet benefits? And how do you manage that?
That's a great question. Okay. And two important things from that is just the microbiome in general. I mean, what an exciting field in medicine right now. And I think a lot of the microbiome holds a lot of secrets that we are just beginning to scrape the surface on. And I'm really looking forward to, seeing what the next few years are going to hold as far as what we can learn there. But the second one is a concern about colon health, right? And so fiber, of course, breaks down into short chain fatty acids, and we know that feeds the lining of the gut, right? And that's important. But right there is helping patients understand what is a well-formulated ketogenic diet and what is not. A well-formulated ketogenic diet has fiber. We really encourage consumption of non-starchy vegetables, at least 5 servings a day.
Could you have more?
You could have more, right? And it also depends on your personal carbohydrate tolerance. So many of our patients are having more than that, or in some cases, getting other fiber sources through nuts, okay, or through berry fruits. So it is not a no fiber diet. So we have plenty of fiber available to break down into short chain fatty acids if this is done correctly, right? If it is truly a well-formulated ketogenic diet.
Do you supplement with resistant starches like plantain or acacia or?
As a general rule, no, we don't. And I think that is definitely an option for people who are interested. But one of the other really interesting and intriguing questions is, so not only are our patients on a well-formulated ketogenic diet actually getting those short-chain fatty acids from the breakdown of fiber, okay, it's not a no-fiber diet, but also, one of the short-chain fatty acids that's really doing a lot of the down and dirty work there is butyrate. And wait a minute, our patients have elevated level of beta-hydroxybutyrate. And when you look at the chemical composition of these two, darn it, are our patients on a ketogenic diet actually getting 2 sources of that important gut nutrition? They're getting it from the short-chain fatty acids made from the breakdown of their non-starchy vegetables, berry fruits, and nuts and seeds. And are they also getting it through a secondary source, which is beta-hydroxybutyrate? Now, the question is still a question at this point in time. I think that would be a really interesting area of research, and somebody needs to do that study.
So how do you then address the issue, though, around the microbiome? Do you just say, well, we're getting enough fiber? And have you guys seen studies that check on a keto diet and what happens to the microbiome? And is it sustainable? What happens over the long term?
Good question. And so the studies that are looking at a high-fat diet having a negative impact on the microbiome are not studies done in the context of carbohydrate restriction, and that's really important.
Yeah, I was going to say that. Yeah.
So, when you look at, I think no one in the low carbohydrate, research community would ever think that combining an increase in fat with a continued increase in carbohydrates is a good idea. Okay?
Can you explain why?
So again, when you eat the carbohydrates, the big important thing is we're increasing the insulin level, the fat storage level. So that if we take that metabolic state with these high insulin levels, and now we throw a lot of fat on there, insulin being our fat storage hormone, we're setting up people for all kinds of problems. I mean, that really essentially is the standard American diet. It's not working. It's making us sick. Not a good idea. So
all that sweet fat, when you combine carbs with fat, it's actually eliminates any benefits of a higher fat diet and actually causes much more adverse effects.
Absolutely.
And I think when you look at a lot of the data on these studies, they are studies combining high saturated fat or high overall fat content with a high carbohydrate content, and that's a deadly combination.
I do. I absolutely believe that. But that's what catches the headlines, right? And so this is really important for everyone, providers and consumers and patients themselves, right? Of these, when the headline flashes up that says high fat diet is bad, you got to go in to the study itself and look at what they were actually eating. Because what is really troublesome is that the high fat diet aspect of this is what catches the headline. When you really look at it, it was a high fat, high sugar diet. And it's most likely the sugar that's causing the problem or the refined carbohydrates in that diet. But that's not what catches the headline. You never see the high sugar diet, or high refined carbohydrate diet flashing across the newsreel at CNN, right? What we see is that the negative, it always gets blamed on the high fat. And so I would say the same is for the microbiome literature. There was recently a study coming out looking actually at fat in a carb-restricted state that did not show negative aspects on the microbiome. So we have to be really cautious when we interpret those data.
I agree, because I've seen those studies on animals, for example, and they, you look at it's the mouse diet or the rat diet, and they actually are high usually in PUFAs, omega-6, and they're also high in the carbohydrate load. And then other studies I've seen actually with improvements in the microbiome using omega-3 fats, which is kind of fascinating. So there's a whole sort of complex story there that needs to get sorted out. But I think a key point is the correctly formulated keto diet is important. That includes a lot of plant foods as well as high fiber.
Correct.
And you can be vegan keto, right?
You absolutely can be vegan keto. I mean, so again, this goes back to patient preference, okay? Patient culture. And patients' other medical conditions. So, we have to look at each person as an individual. So you take someone who has type 2 diabetes and eats a vegan diet and continues to progress with a typical vegan diet, but doesn't want to give up the vegan aspect of their nutrition plan. So you do a low carbohydrate diet with a vegan lifestyle. I mean, they absolutely are not mutually exclusive. They can work really well together. I will tell you that a lot of our patients are vegetarian, a lot, and they do just fine on.
Let's talk about dairy, because there's a lot of controversy about dairy. One, the homogenized, pasteurized, feedlot, antibiotic, hormone-rich, genetically altered cows, meaning through hybridization, produce a product that's very inflammatory, that produces gut issues for many people, that may be linked to all sorts of chronic illnesses, including cancer and autoimmune disease and allergies and asthma and digestive disorders. So how do you think about including that as part of a keto diet? Because typically in the keto community, there's sort of a split between the dairy-free and the dairy. And the dairy is easier to do because you can eat cheese, you can eat butter, you can have cream. Sounds like fun, but is it really a good idea?
Well, so I think the crux of that question, the most important beginning part there is how we produce the dairy, right? Or the meat for that aspect, right? I mean, so do I think that feedlots and the way that we currently run most of our agriculture is a good idea? Absolutely not. I mean, I just don't think you're going to get almost anyone. I'm sure there's somebody out there who would argue it's great the way it is. But I mean, I think most of us who really understand that the way that we're doing livestock right now is not good. These animals need to be pastured, right? And we just have to change the whole system.
But even so, they're going to be homogenized and pasteurized. There's studies that show, for example, raw milk has very profoundly different effects, or raw dairy, than homogenized dairy on lipids, for example. That's just one thing, but same amount, same quality.
Right. So I think the research on dairy is right now actually leaning towards dairy being more protective in many aspects. And of course, this is taking into account that a lot of the dairy out there is, again, like you said, these feedlot produced dairy. And so, which I've already said we need to change. But for many people, dairy can actually be a positive thing. Now, I don't encourage anyone, on a ketogenic diet, you shouldn't be consuming milk anyway, right? But we still have the cream aspect and the butter aspect. So we encourage whenever possible for people to source their dairy better, right? So we encourage them to look for the grass-fed butter, the grass-fed cream, the grass-fed cheeses, which are becoming, the consumers are asking for it, and we can see all of a sudden in the grocery stores, we're getting more and more and more of these available. So it's much easier for the consumer now. But we don't actually counsel anyone to go dairy-free from the inception of a ketogenic diet. We personalize for each individual patient, and what we find is that some people do better off dairy. Great. We have certainly ways that we can counsel them to still be able to adhere to a well-formulated ketogenic diet without dairy. But that's not in everyone. And I would say that's the minority of the patients who seem to have an issue with dairy. Even for our patients who are, again, the majority who are consuming dairy, what we still see is still significant decreases in inflammation and improvement in type 2 diabetes. So
interesting to compare the two, like dairy, non-dairy, keto.
Yes, absolutely. We need to do that. That study needs to be done. It has not been done yet. And I think it's a really important area of further exploration. More research is needed.
Okay, a couple of quick questions. What about those patients who get resistance to weight loss? So they go keto, they drop a ton of weight, and then they just plateau.
So yeah, that's a really great question and something that does happen. And so I will tell you, my first discussion with patients includes this. There are 3 things in life that are guaranteed: death, taxes, and a weight loss plateau. Everybody's going to get one, right? That is an absolute thing. And so the first thing we have to do is counsel patients on that before they hit their plateau so they know to expect it. Because a lot of times in these people, it just takes time to work through the plateau. And like, if we could talk to someone.
How do you do that?
Yeah. So if you could talk to someone, right? And I actually say this to my patients. I'll say, look, if I could tell you, don't worry, your plateau on April 18th, it's over. It's going to be done. People could say, that's fine. I can work through it. I can get to April 18th, right? But because we can't give them this specific time frame, we have to be more general and say, and sometimes patients can have this plateau that lasts over a year. And you just have to understand.
And they just break through it?
And then they'll break through it. In many of the cases, they do. But when they hit those plateaus, the other thing that we need to go through is go back to doing a couple-day food journal. Okay, because sometimes the people who are experts at this, the experts in well-formulated ketogenic diets, can be their own worst enemy. Okay, myself included. I mean, again, I'm talking about no matter what level of expertise you are on this, you wind up getting a little complacent and saying, oh, that's a half a cup of tomatoes, right? So I'll say, let's go back to actually look at what you are consuming. So my recommendation, and I'll tell patients this from the beginning, is no matter how good you get at this, every 1 to 2 months, you need to go back and spend 2 days writing down what you eat and taking a look at it. And are you all of a sudden having more, maybe really good carbs sneaking in? It's no longer a 1/4 cup of nuts. It's a half a cup of nuts, those kinds of things. And we find a lot of times the problem lies right there.
Okay, next quick question. What about cancer? There's a lot of interesting data emerging around ketogenic diets and cancer, and the theory is that cancer cells only run on glucose. They can't run on ketones, so you starve them and the cancer dies. Mm-hmm. How good is the data on that?
So the Warburg effect is what we're really talking about. And so I think, again, this is an area of emerging science. I certainly think that right now the data is really positive in a ketogenic diet plus standard of care. Do I think that there's any evidence for a ketogenic diet as a standalone treatment for cancer? No. So for anyone who has a more metabolically driven cancer, which is probably most of our cancers now, adding a ketogenic diet as an adjunct to their current standard of care may very well be a reasonable option. But again, it's a real emerging area of science, and I think we need to wait for a more definitive answer. But I think one of the things that we can say is,
I thought this was a low-carb conversation. You're serving up a little bit of waffles here.
Well, I wouldn't say waffles. I would say being honest about where the evidence lies, right? Where the evidence lies, because we don't want to replace a lot of decades of bad advice with other bad advice. And so we have to be honest of where the evidence exists and where it doesn't. And cancer is one of those emerging areas. And I think it'll be really interesting to see where the data leads us as far as the potential of implementing a ketogenic diet as kind of a standard of care along with our other current standard of care when treating, because it appears that a ketogenic diet makes radiation more successful.
Adjunct.
As an adjunct, right. And so I think it's going to wind up having its place. But again, jury's still out on it right now. But do I think that it's negative for anyone to, say, I don't want to wait because my problem is right now, and add it as an adjunct treatment to their
It should be standard of care.
It possibly may soon. But even though before we have that conclusion, before we have that data, I think it's a reasonable option for people to do as long as they continue to adhere to the other standard of care treatment for their cancer.
Yeah, it's astounding. I had a patient who was a radiation oncologist at MD Anderson who shared me the nutritionists there are pushing high carb, sugar, milkshake diets on their patients with cancer to keep their weight up, which might help, but it also might just feed the cancer.
And the other thing too, though, when it comes to the weight is there is pretty good data to show that once cancer has gone into remission, if patients, most specifically the data here is on breast cancer, if once patients have gone into remission and they gain weight, they have a much higher incidence of the cancer recurring. So again, that's kind of a critical time to make a change and not to be pushing some of these high carbohydrate diets.
Absolutely. Okay, next question is about exercise. We've all been trained that we should have big bowls of pasta before a competition and before a marathon and carb load as a strategy for increasing athletic performance. But there seems to be another view here around how keto works for elite athletes, for the average person. Can you talk about that both in terms of the aerobic fitness as also the anaerobic fitness, like strength training?
Yeah, and I think, again, this is beyond just emerging area of research, right? We have some really good trials done on this already that shows that even very high-performing, more in the elite status athletes can see performance benefits actually with a ketogenic diet, right? Which seems counterintuitive. Well, wait a minute, you have to carb load right before these activities. But again, people are carb loading because they're already in a state of utilizing carbohydrates as their energy source. When someone is adapted to a well-formulated ketogenic diet, they're fat adapted, if you will. Their body has already learned to rely on fat as an energy source. It can actually be an advantage, especially for the long distance endurance athletic endeavors. So again, and there's been studies looking at more anaerobic type of athletic endeavors, and the jury is a little mixed on whether it actually improves or just doesn't change performance. But I think it's a really interesting area, and we're seeing more and more athletes reading the science, understanding it, and getting counseled not to continue to take down the Gatorade and take down the pasta, but instead to be relying on a lot of their energy as fats. We're seeing professional teams do it now. So I think it's going to really possibly change the way we advise athletes in general on this.
And in terms of, the opposite view, there's a movie coming out called Game Changers, which was produced by James Cameron, who did the Titanic, about vegan athletes, showing the strongest man in the world and this high-performance person eating a high-carb vegan diet. What do you have to say to that?
Well, I have to say to that for some people, that may be okay, right? I mean, I'm not going to say that no one could do that and have a good athletic performance. But I am saying that on a typical vegan diet, which is a high carbohydrate diet, what happens in athletic performance is we go through these peaks and troughs. I mean, anyone who's done a distance running race knows, what do you have to have on your distance running race? You have to suck down goo, right? You've got goo, you've got to stop and eat, you've got to suck down the Gatorade. And what are all of those things made of? They're made of sugar. Right? So we've got ourselves in this state where in order to maintain the energy that we need to complete an endurance event, we have to suck down sugar for our energy source. And the problem is when we suck down that sugar in the energy source, the other thing that comes, not only does it have to be continually repleted, right? We have to constantly take more and more and more of it the longer the endurance events, but also we have to deal with the digestion of that, right? And so we've got all this blood going to help with the digestion of it. Instead, really, we want the blood to be going and diverted to our muscles where it can be used for the actual event. Again, so there's a lot of inherent problems with that. And so yes, people can rely on goo and all those other high sugar carbohydrate sources during the runs. But one of the questions that I have is what is that going to do to them over the long term, right? I mean, what we see is that there is this kind of emerging problem of some of these endurance athletes who have been carb loading and doing all those sugar sources during events for so many years, and they still have low body mass. I mean, they're still very lean. They're still exercising like crazy, but diabetes has somehow all of a sudden entered the picture. And I think that's a really serious question that we have to ask. So do I think you could be a vegan endurance athlete? I think there are some people who could do it. They're going to have to supplement with, carbohydrates during the event. I think that there's probably a better way to go about it.
Well, any last thoughts or words?
Yes, my last thought and words is that type 2 diabetes is a reversible condition. And I think one of the most important things and the responsibility of every healthcare provider is to know that, to communicate with their patients that type 2 diabetes is reversible, understand the ways to reverse it. There's 3 that are clinically proven, and that would be bariatric surgery, that would be a very calorie-restricted diet, and that would be a low-carbohydrate intervention. They have to know enough about those to have an intelligent conversation with their patients and allow their patients to choose which method is the best option for them if they are interested in not seeing their disease progress, but actually reverse. So it is a responsibility of all of us.
Amazing. And what's next from you?
What's next? Well, we've got probably the next biggest news is that we're going to be publishing our 2-year results.
About your smile, I imagine they're good.
Well, we are certainly not going to be hesitant to put them out there in the publication world and contribute to the further evidence that, again, not only diabetes is
sustainable,
but it's sustainable, and a low carbohydrate intervention is a wonderful option for the people who choose it to get that reversal.
Thank you for your work at Virta and for your work in the Nutrition Coalition to change policy around nutrition guidelines, and look forward to hearing more from you.
Thank you so much.
Thank you, everybody. We'll see you next time.